We see patients with coronary artery disease, valvular heart disease, and thoracic diseases as well of the lung in particular, and the center of the chest known as the mediastinum. When I get a call with someone with one of those issues, I would go evaluate them and then perform the appropriate surgery based on their disease process, either coronary artery bypass grafting or valvular repairs or replacements, thoracic procedures like resections of tumors or masses in the chest.
Many times they come because they have symptoms, so they're hurting or they can't breathe, or so they've seen their primary care doctor or their cardiologist and a problem's been identified. There's a surgical evaluation to be done. We try to evaluate the data that we have, what their symptoms are, and then propose a plan based on what we know and what the evidence is to provide a way for them to go forward so that they have a longer life and have a better quality of life. Well, everybody's different, so it's not a one-size-fits-all, but many times patients that have bad valvular disease or acute coronary disease will find within a relatively short time that they feel much better, that if we fix the problem that's been identified, that their quality of life and their sort of sense of well-being is greatly increased within, I mean, you have to go through the surgery, but within a month or two, and sometimes within a few days.
Well, I mean, essentially I want them to feel better. You know, if somebody comes in with a problem, whether it be life-threatening or not, my goal as a physician is to make them feel better, to make their quality of life something that they feel good about. And that to me is the biggest outcome effect that that keeps me coming back for more, is that these people really do feel better and let you know that.
We have a great team of people. We've developed people and expertise over the years. We have a group that is committed to caring for patients that have heart disease, and you know, there is no substitute for experience. And in the operating room and in the ICU and in the telemetry units, people have really come to understand the protocols that we use and be in a position to really anticipate problems and see better outcomes.